Hello, everybody. My name is Jason Howell, and I so wish I was there with you. I had been planning on going, getting excited about going to the island. I used to live in McAllen, and we used to go to the island all the time. And I was so excited to get to go. I haven't been there in years, but I caught COVID. So sorry about the voice. So trying to, try to make up or do something. I created this video that hopefully they can play for you. And I know it's not going to be the same as me being there and having an interactive conversation, but hopefully you can, take away some knowledge. And I definitely will make myself available for follow-ups and have a conversation because this is a very important topic. So more about me. I'm a person in long-term recovery from both mental health and substance use issues. And recovery has given me a lot of things that I wouldn't have been able to do back in active addiction. And one of those is to be the executive director of Recovery People. We are a statewide recovery community organization. We have programming across the state. And one of the areas that we focus in on is recovery housing. But kind of even going back, what are my roots in South Texas? I grew up in an area called La Gloria, which is between Falfurrias, Fremont, and Heronville. It's a very rural, frontier part of Texas, and it didn't really have a lot of recovery support services or services in general. And so I felt very fortunate that I was able to go to college and then from there, get employment and from there have access to the recovery support services that I needed in order to start and sustain a long-term recovery. And I oftentimes reflect on, what if I had stayed in South Texas? Would I have been able to access those services? Would I even be alive today? And it's a sobering thought, no pun intended. But that's why this is so important to me to talk about, how can we bring, more services to South Texas, especially the Rio Grande Valley, and why I wanted to talk today. More about me. Once I got in recovery, I opened recovery homes. I managed recovery homes. I helped establish the national standards for recovery residences. And so this topic is definitely something that's important to me. Let's see. So today's topic is why culturally responsive recovery housing matters to the Rio Grande Valley. And before we go any further, I just want you to let you know, I know that you don't need some white boy from north of the checkpoint to talk to you about the culture of the Valley. That's not what I'm here to do. You all are experts in your culture. And I think that my hope is at the end of the presentation, I'll have highlighted the importance of culture and how your community can adapt the recovery housing model to be most responsive to your community. All right. So just learning objectives. Today, you'll after the presentation, you'll be able to describe the different types of recovery housing and why they're needed by persons in early recovery, and discuss reasons why past attempts to establish recovery housing in the Valley may have failed. And then I'm hoping for us to get into a discussion about next steps and what can we do as a community to open recovery homes and make more recovery services available. Before we jump too far in, I wanted to give you this graphic representation of recovery housing in Texas. This was part of the NSTAR study. It stands for the National Study of Treatment and Addiction Recovery Residences, and it was done in 2022. So this data is pretty fresh. You'll obviously see this is an image of the state of Texas. You can see the different counties in Texas outlined. Some of the counties are darker green. Other counties are more yellow. And then you see little black dots on the map. So the black dots are where recovery housing is. At least in 2022, the researchers were able to identify recovery housing in those areas. The lighter yellow color indicates that the county is more urban, and the darker green, the county indicates that it's more rural. So there's some pretty, striking findings if you just look at the map, where, thinking about where are the dots, where are the recovery housing in relation to urban or rural. And obviously, they're located more in rural area. I mean, I'm sorry, in urban areas, and except along the Texas-Mexican border. I mean, let's look at, upper and lower valley, mid valley, as well as El Paso and Laredo. There's not any recovery residences, or not recovery residences that the researchers were able to find. So there could be all kinds of reasons why, including just a lack of investment by our government in building out the infrastructure along the Texas-Mexico border. But I also think that there are some cultural reasons why, if individuals from the north would come down to border counties and try to open up recovery services, why there might be challenges, some cultural barriers that we'll talk more about today. All right, let's move into the question, what is recovery and how do we support it? So here's the definition that SAMHSA developed back in 2012. And I'll point out that this definition is thinking about both mental health and substance use together. It's some people will call it the wellness definition. It's a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. The second bullet point is from the Betty Ford Foundation. And so this is more specific to substance use disorder. And their definition of recovery is a voluntary, maintained lifestyle comprised of and characterized by sobriety, personal health, and citizenship. So this concept of citizenship, being a good citizen. But all that happens in a context, and the fancy word for it is a milieu, the physical and social environment where someone's at. And the graph shows the social ecological model. There at the center, you can see the individual is on their person-driven journey, but it's in the context of determinants of health. And then outside of that, then there's policy culture. There's just a lot of the context, the environment that really impacts. And the CDC, that's the quote there at the bottom. The non-medical factors and conditions in the environment where people are born, live, learn, work, play, worship, and age impact a wide range of health, functioning, quality of life outcomes, as well as risk. So when we're thinking about recovery support, not only do we think about supporting the individual along their person-driven path, we also need to be thinking about the context that they're in and how we can use that environment to support them and shape their recovery. So a super simple definition of recovery support services, or sometimes you may have heard it as RSS, is that these are non-clinical services that support recovery. And I will go on to say that there's really three kinds. First is the recovery milieu. Remember, I just got through talking about the physical and social environment, the context that people are in. And when you look at it this way, you can think about these recovery supportive settings. It's the setting that is the service, the culture, the network that we build, all can be recovery supportive. And these environments, these milieus can be cultivated, wherever people are. And when you think about where we as humans spend a lot of our time and where we, interact with others, first is in our home where we live. Second is, we spend a lot of time at work, or if you're younger or maybe not so younger, you're going to school. And so you spend a lot of time at school. And then the third is, so where do we connect with each other outside of home and work? That could be a church, that could be at a softball league, it could be any number of places that we gather and commune. So, we can develop these recovery supportive milieus in any one of these places. But if obviously today we're talking about recovery housing, which is where people live. The second type of recovery support service that I wanted to highlight is one that you may be more familiar with. This is the peer specialist services. And back in 2007, the Center for Medicaid and Medicare Services up in Washington, the federal government, they authorized the reimbursement of peer services. And those services were defined as services delivered by peer specialists. 10 years later in Texas, in 2017, we passed the peer specialist bill. And so now peer specialist services are Texas Medicaid billable. And because of that, you're probably familiar with, peer specialists, or sometimes they may call them recovery coaches. They help individuals with their person-centered recovery planning. They can do outreach and inreach into to jails and prisons. They can, do work on warm lines. There's just so many different things that a peer specialist can do. It's a very versatile role that can engage people where they are throughout the community. And then the third type of recovery support service I would like to highlight is life skills development. Sometimes you may hear this as psychosocial rehab. Other people just refer to it as habilitation. Really, we're talking about what are the skills, the life skills that an individual needs to be successful. So many times, people with mental health and substance use issues, for whatever reason, didn't learn a particular life skill, and that's what is holding them back. So examples of this might be, a vocational education, job readiness, trainings around independent living, around social skills, anger management, budgeting, management. There's just a long list of different life skills development that people may need to be successful in their recovery. Then the next thing I wanted to highlight is that really we can bundle these. You can make a happy meal out of it, right? You can bundle the milieu with the peer specialist services and life skills development, and really think about, what does an individual need to be successful? And so let's package the types of supports that that individual needs. And then as they evolve, we may pull one away or change it up a little bit, but just thinking about, what is it they need at that particular moment. All right, that is going to lead me to the conversation about what is recovery housing. So according to the federal statute, this was defined in the Support Act of 2018. Recovery housing is a shared living environment free from alcohol and illicit drug use. It centers on peer support and connection to services that promote sustained recovery from substance use disorders. From there, SAMHSA developed a paper about recovery housing and established it as an evidence-based practice. And in that paper, they defined recovery housing as safe, healthy, family-like, substance-free living environments that support individuals in recovery from addiction. They vary widely in structure. All are centered on peer support and connection to services that promote long-term recovery. They benefit individuals in recovery by reinforcing a substance-free lifestyle and providing direct connections to other peers in recovery, mutual support groups, recovery support services, etc. And then I think that the big bullet point that SAMHSA highlighted, and this is true, that the definition of recovery can include taking medications as prescribed. So the language they actually used was substance-free does not prohibit FDA-approved medications taken as prescribed. So I think there was a concern that some recovery housing was not allowing people to take their medications. Granted, people, they do divert their medications or they may be taking it illicitly. That's not what we're talking about. We're talking about medications that the doctor prescribed and that the resident is taking as prescribed. And then that brings us to Texas. Yes, Texas has a recovery housing law on the books now since 2023. And it defines recovery housing as a shared living environment that promotes sustained recovery from substance use disorders by integrating residents into the surrounding community and providing a setting that connects residents to supports, services promoting sustained recovery from substance use disorders. It's all centered on peer support, and it is free from alcohol and drug use. I'll put an asterisk there, illicit drug use. But, in reality, you hear all these different terms. I mean, there's Oxford House, sober living, halfway house, three-quarter house, transitional housing, supportive housing. I mean, just on and on and on. And so it gets real confusing as to what is what. And that's when the National Alliance for Recovery Residences, or NAR, kind of came into the scene around 2011, 2012, and kind of looked at all these names, all the different types across the nation. And, we've got to standardize the language. We have to help people understand what they're talking about. So what NAR did is establish a common language. From there, they developed national standards and levels of support. And so you can think of the levels of support as the different models. I think one thing that NAR tries to make very clear is they didn't go invent anything. They just looked across the landscape of recovery housing, recovery residences across the United States, and were able to kind of frame them and group them together in a way that made sense and that people could understand. And that's what we're going to cover here next. So I mentioned that they NAR identified the 4 levels of support, and that's what's represented here by the 4 little houses. And to better understand what these are, let's take a look at what types of services that they provide. So, as you heard from all the definitions, all recovery housing provide an alcohol and illicit drug-free housing. And they do that in a couple different ways. There's policies and procedures and house rules that are all centered around creating this safe and supportive environment. But a house that's just alcohol and drug-free is not recovery housing. It's so much more than that. That's kind of like the baseline, because there's a lot of alcohol and drug-free housing that doesn't cultivate the recovery support that we would find in an accredited recovery home or recovery residence. So something that's very unique is this recovery supportive milieu. Remember, that was a term, a concept that I introduced a couple of slides ago. And I'm talking about the social and physical environment, the context that really can support an individual seeking recovery. To go even further, how do you develop this recovery supportive milieu? Well, some of the core tenets are that, you create a peer-led and an authority-based on lived experience. That's a big part of creating the culture within the home. You also think about peer governance and peer accountability, really thinking about how can you give persons with lived experience and the residents some, meaningful ways of making decisions. And even when they may not, may have a lot of opportunity to strengthen their decision-making skills. And that's part of it. You give them just enough responsibility and holding each other accountable to where they can learn those skills. And eventually, when they move out of the recovery home, they will have those skills that would be successful, that will support them throughout life. Also, this milieu, the culture, it's very recovery oriented. It understands that, the disease, the addiction is just part of it. It's so much more than that. You have to approach recovery holistically, and there's a lot of cultural elements that can support recovery and kind of, create a psychological sense of community, a family, if you will, within that recovery home. And then also that it be community oriented. And in recovery housing, they talk about community in specific ways. They see community as an asset. And that's not the community that is being built, those pro-social relationships within the recovery home, that community, as well as looking at the context, the surrounding community. What are there mutual aid groups? Are there other recovery supportive groups in the larger community, assets in the larger community that you teach residents how to make good decisions, to choose which connections, which resources that would be recovery supportive for them. So again, it's giving them the life skills that when they move out, that they will have a rich life in recovery. Okay, moving on from recovery supportive milieu, the other thing that we start seeing, and let me back up a little bit. So all recovery housing provides alcohol and drug-free housing. All recovery housing provides this recovery supportive milieu. Some people call it the social model, but it's that recovery supportive milieu that you cultivate, and it can be harder than you think to cultivate and maintain it, but it's the secret sauce of everything. Then as you move up into the different levels of support, the higher levels of support, you see that we start bundling services. Some level twos, but definitely level threes and level fours start providing peer specialist services. When we're in threes and fours, you start seeing life skills development that we talked about. And NAR even identified where the recovery and social model intersects with the clinical model in level fours. And so in level four it's not only recovery housing, but it is treatment services, addiction treatment services, clinical services. And so actually in the state of Texas and a lot of places don't really see level fours as recovery housing, but NAR found it important to go ahead and define the entire continuum of care so that you could see, how they would, a person would move to different levels of support based on what they need. So let's talk a little bit more about that. Oh, so again, the different ways you can tell the different levels of support is by what service bundles they have. The other way that you can tell between the different levels of support is by their different staffing and governance models. So a level one, you can see, all the people there, the little images that represent people, they're all the same size, the same color. It's meant to communicate that they are a self-governing entity within the home. They're democratically run. They elect a house president, a house treasurer, the different offices. They elect people into the house. They vote on people, moving out of the house. So it's very much democratically run. The largest level one recovery residence in the world is Oxford House. So you may have heard of Oxford House. And so that is the best example of a level one. So let's move to level two. The level twos are very similar to level ones in that you've got that recovery supportive milieu, that community, that culture that's peer run, peer governed. But rather than democratically electing a house president, the owner operator appoints a house manager, or sometimes they're called a senior resident. But there's somebody who is head of household that oftentimes acts as the liaison between the owner operator and the community that's within the level two. So when we move to level threes and fours, if you think back to the slide that we just previously saw, there were lots of other different services bundled, and somebody's got to be delivering those services. And so in addition to that core social model, recovery supportive milieu that you find in all and the staff and the residents that support that, you have this layer of individuals who are trained, credentialed, and supervised in level threes and level fours. So the levels, there's a really nice thing. It creates, as people need different levels, they can be matched with the level of support that they need. So typically, there's not a validated placement tool whatsoever, but in general, we see that people that have higher disease complexity and severity tend to need a higher level of support. That's logical, right? And then on the flip side, you have people that have higher recovery capital. And if you're not familiar with the term recovery capital, those are the internal and external strengths that an individual has. So if somebody has, more recovery capital, more strengths and assets at their disposal that they can use to support their recovery, they tend to like to be placed in the lower levels of support. So when you put this together, the levels of support cost effectively match individuals with their need. All right. So why recovery housing? Why are we even having this conversation about recovery housing? So first, let's think about substance use disorder or just substance use in general. There's some individuals who can use alcohol or maybe even use drugs, and it's all at a subclinical level. They may have a half a glass of wine with dinner. They may have, a little sip of champagne at New Year's, but really not have the compulsivity of using substances. Then, if we move along that continuum, the vertical axis, then you get to individuals who are hazardously using, and that can look like them maybe, consuming over 5 servings of alcohol in one setting. They could be using various dangerous drugs. That it's not only hazardous for them, it may be hazardous to the people around them. And then, addiction is a progressive disease. So at the other end of the spectrum, you have individuals with a substance use disorder or an addiction. So that gives you an idea of the diversity or the range of needs or of, who are individuals that are using substances. So now let's take a look at a horizontal axis. Just because somebody is using and maybe even hazardously using or having addiction doesn't mean that they understand that they have a problem. For the clinicians in the room, this is pre-contemplative. So they're just not even aware that they have an issue. Then as we move to the right along the continuum, there are individuals that are like, well, okay, I do have an issue, but you know what? I'm not willing to stop. I don't want to give up using. It does something for me. I want to try managing my usage or using it in a way that is less hazardous. And so we would call that harm reduction. And then all the way to the very right end of the continuum, you have, I want to stop using. These are individuals who have realized that they can't use substances and live a fulfilling life or their full potential. So they want to pursue an absence-based recovery pathway. Those are the individuals that recovery housing was designed for. So all this to say that recovery housing is not for everybody. This recovery housing was specifically designed for individuals who want to stop using and who have had a history of hazardous using or of substance use disorder. Thinking even further of why recovery housing, and I think it's important to remember that most people with a substance use disorder return from treatment, and that could even be inpatient treatment or outpatient treatment, or an institution like jail or prison, to living environments that enable an addictive lifestyle. So if they go back to their environment, it may undermine their recovery, even though they want it really, really bad and are trying. There's just that context. Remember that recovery milieu that we keep talking about that may not be conducive to their recovery. So one of the reasons why recovery housing was developed is to provide them a safe and sober and recovery supported living environment for them to get that type of support. I think, for some people with substance use issues that choose recovery housing, they may be chronically homeless. They may have been on the streets for a long period of time. And in some cases, an individual, their substance use may have caused them to miss a rent payment or something like that. And so they're at risk of being evicted or unstably housed. So a lot of the times when people hear the word recovery housing, they focus in on the housing piece and just think of it as just just as housing. While yes, it can be housing, it's more than that. You know, when I say recovery housing, I'm really thinking of the word recovery and being a supportive. And the reason I say that is because some people that choose recovery housing, they're homeowners. They may have a mansion, they may have multiple homes, but living in their own home may not be supportive of their recovery. That may be undermining. They may be isolating. They may be living with, individuals or in a neighborhood that leads or supports an addictive lifestyle. So even those individuals with homes would choose recovery housing to support their journey. How many of you have heard your grandfather say this saying, tell me who you're walking with and I'll tell you how you are. Individuals in early recovery often have to avoid people, places, and things that reinforce their addiction and establish new recovery supportive friendships. So this is kind of building on what we've been talking about. It's not only that when I say the setting of like the physical setting, the setting's also the friends and the social network that you have, and is that family of friends recovery supportive? And then, some individuals that choose recovery housing may be estranged from their families, but others may have loving families. And, addiction is a family disease. They call it a family disease because it affects family members, it affects family dynamics, it affects the family system. And so even if one of the family members doesn't have a problem with substance use directly, they may be unwilling, pulled into an unhealthy dynamic. And that's why it's not healthy for them or healthy for their loved one with a substance use disorder for them to be living in the same household, at least not at the beginning of recovery. They having some separation and having the loved one establish some recovery and establish better communication lines and skills can be very beneficial. Early recovery, the disease of addiction and early recovery, it's very confusing for family members. And so just because someone has a loving family or a good family, quote unquote, doesn't mean that their loved one wouldn't choose or wouldn't benefit from recovery housing. So let's start getting into some of the numbers and some of the stats, which from the qualitative reasons why recovery housing is get into the quantitative. So recovery housing generates better outcomes. There's been multiple studies. It's probably one of the most studied recovery support service that there is out there that shows that recovery housing improves abstinence and mental health. It improves employment rates, monthly income. There's studies that show that it improves the unification of mothers and their children, reunification of families. And research shows that it decreases criminal justice involvement. So with all those outcomes, it's no surprise that recovery housing generates cost savings. When you compare, recovery housing to other types of housing, granted, these prices or these costs are a little dated back in 2011, but I think they still will hold true today. It is cheaper for somebody to live in a level 1 recovery home compared to if they were living in a housing first, which is a harm reduction approach to housing for persons with who've experienced chronic homelessness. And it's definitely cheaper than housing somebody in the jail or the prison. And it's definitely less expensive than housing somebody in a residential treatment bed. So lots of reasons from a cost savings perspective why individuals would be looking at recovery housing. And studies showed that a Oxford House stay was estimated to be roughly, or to save roughly $29,000 per person on average. So for every person, and again, these are dated numbers, that number is going to be even higher because of inflation, that it saves substantial money because people are decreasing in their criminal justice involvement, increasing in mental health, And that's not even talking about them getting jobs and being more productive, higher employment rates, et cetera. So now let's switch gears and talk about why culturally and linguistically appropriate. So the federal government, the Health and Human Services at the federal level has published the national standards for culturally and linguistically appropriate services. It's called CLASS. And it's a very rich resource. I encourage you to explore this if you've not seen it before. And I love their catchphrase. It's like, think culture, because culture, the context of culture definitely matters. It's how we filter everything. It's how we communicate. It's how we understand. So of course, culture matters. The class standards, there's 15 of them. And for the first one, I went ahead and wrote it out. And then for the rest, I just kind of summarized. So the first standard is provide services that are responsive to cultural health beliefs, practices, preferred languages, health literacy, and other communication needs. So definitely think about that, because we're going to hopefully get into a discussion around this a little bit later. Other things to keep in mind from a standard standpoint, standards 2 through 4 talk about governance, leadership, and the workforce being reflective of the community that they're serving. This is very much in alignment with recovery housing, because you're wanting to have peer leadership, peer governance, peer specialist. These are all individuals with lived experience, and then within a recovery supportive milieu and psychological sense of community, the authority-based is other people with lived experience. And so recovery housing is just naturally going to be aligned with these standards. If you look at standard 5 through 8, it's all about communication and language. When we're communicating to the residents or developing whether it's internal communication or external communication, how do we do it in a way that is reflective of the community that's being served? And then 9 through 15, it's really about that continuous quality improvement, and what things do you put in place that allows you to hold yourself accountable to these particular standards. All right, so let's take a look at Valley culture. And I am not telling you anything that you don't know. Just with your permission, I wanted to bring this to the table so that can stimulate conversation. So when we think about the population of the Valley, it is predominantly Hispanic or Latino. These numbers I pulled from RGV Health Connect. They may be a little dated, because I think the most recent numbers might look slightly different than this, but it still holds true. Over 90% of the population in the Rio Grande Valley are going to identify as Hispanic or Latino. That's way more. That's more than twice as many as in Texas. And then your non-Hispanic or Latino is going to be only 8%, 7%. And that's much less than throughout Texas. So, and I'm not saying that, the Hispanic culture is a monolith. There are differences within the Hispanic community. It's very rich in its diversity. But I think there are some general things that we can think of. So if we're developing recovery housing that's primarily going to be serving individuals that identify as Hispanic, Latino, Chicano, then we need to be thinking through, how do we adapt the recovery housing model that in a way that it's congruent or responsive to the Valley culture. With that, I think that, it's well documented that the way that the Hispanic and Latino culture thinks about gender roles is unique, and there's very strong points of view around that. There's some strong points of view around the role of the family. This is not disparaging it in the least. It is what it is. And actually we can think about, how do we use that as a strength? In addition, we can think about, health literacy and, how from a cultural lens, how individuals understand the disease and understand the recovery process. Of course, that is filtered through culture, and we need to be thinking about that. And then also thinking about the role that spirituality and religion plays, how important it is to the Hispanic community. And I there are people in this room that are much bigger experts than me on in all these. I actually heard a presentation for that Miguel Garza um, did there at the state that did a beautiful job, kind of talking about these unique aspects. So definitely lean on experts in your own community when you think about adapting recovery housing for your particular culture. What's the language of the valley? I found this article. It was a research paper that was done by a PhD student at the University of Texas, Rio Grande Valley, Elim Hernandez, and I really, this quote I lifted. When we think about the language of the valley, it's the use of English as the official language and Spanish as the language spoken at home. And to back that up with some statistics, you can look at the graph below. And again, this is data that's coming from RGV Health Connect. And that last line, looking at how many people in the RGV speak Spanish at home, 78.36%. That's a lot. And so when you think about, individuals living in their home, whether that be, their biological family or moving into a recovery home, what are they going to feel most comfortable speaking, communicating? It's going to be Spanish. And so if you have, someone that establishes a recovery home that is predominantly English speaking, well, it's not going to feel comfortable for an individual. It's not going to feel like home for individuals who have always spoken Spanish at home. And an anecdotal story around this. There was a couple of years ago that I ran into a woman. It was during a recovery rally. This is Recovery Month. Happy Recovery Month, everybody. She was from Agua Dulce, and so that's north of the checkpoint. But it's predominantly a Hispanic community, very rural community. And she said that both her and a friend of hers from Agua Dulce moved into a recovery home. There was there in Corpus Christi, and that she was able to stay because she described herself as more bicultural, and that it felt comfortable enough for her to be in a recovery home whose culture was predominantly English speaking or Anglo, but it was not comfortable for her friend, and her friend ended up moving out. And so that's very unfortunate and is a perfect example of why, when we're building and creating recovery homes in South Texas, that we really need to be thinking about language and the culture of the home. I also, going back to Elim Hernandez's study, I really got a big smile when I saw him highlight this. There's so many individuals that are bilingual, both English and Spanish bilingual. And so the code switching, the moving from one language to the other is very natural for a lot of people. And then you can start blending it together. And you've heard some people call it Spanglish. And one thing that he pointed out in his research with the students is they would code switch or move from English to Spanish in one sentence, especially when they were communicating emotions such as happiness, sadness, anger, or fear. And personally, I think there are just some words that have more oomph when you say it in Spanish, right? So again, when we're creating recovery homes for the Valley, you're going to hear Spanglish. It should definitely be woven into the community because that is reflective of the community. All right. So based on what we've been talking about, I want to engage you in some thought. And I realize it's not going to be as easy because I'm not there. You may have to, if you want to do this exercise, you may want to stop the video here in a little bit. And then, if somebody could facilitate discussion there in the room for me. But given the Valley culture, the predominantly Hispanic and the language, predominantly Spanish spoken at home, that's the family language, the home language. Given that culture and language, what can we do to generate the worst recovery housing outcomes? Sometimes it's fun to think about the extreme and creating the worst. It gives us a laugh, and it also makes us realize, oh my God, we shouldn't be doing those. So think about, what if you were building a recovery home or creating some rules, setting up the staffing, the governance model, what is the worst thing we can do given the Valley culture and language? And if you would like, I invite you to stop the video here, and you can have a group discussion in the audience. And then when you're ready to move forward, you can turn the video back on. Well, I'll go ahead and pick it back up. I don't know if y'all chose to do the exercise or not, but if you did, I hope that some of the things that you talked about were, uh, thinking about, the role of family, the role of spirituality and religion to the Hispanic community. And if you created some rules or structure that would like ban the family or ban somebody from seeing their family, or not allow them to go to practice their religious beliefs. If you banned Spanish in the home, and I say that because I'm a person who grew up speaking Spanish until I went to school, and then the teachers made us only speak English. So that exists. And so that's another kind of worst case scenario, is if, the people who opened up the recovery home, or maybe somebody in power in the recovery home, would ban Spanish because they were afraid that, somebody was talking behind their back. These are all things that would be the worst case scenario. So let's move to the next exercise. And it's talking about, what can we do to generate the best recovery housing outcomes? This is when we're building the home, when we're setting up the policies and procedures, when we're developing the culture. What are things that we can do based on Valley culture and language? Because there's strengths in it. It's building on the Valley's cultural and linguistic strengths. How do we bring that into the recovery home and establish a recovery supportive, safe, supportive environment within the recovery home that would promote the best outcomes? So again, I invite you, if you would like to turn the video off and have a kind of discussion amongst yourselves, you're more than welcome to do that. I'll pause a little bit if y'all want to do that. And then if not, then I'll come back on. Well, hopefully y'all did have a discussion, because this is the whole this is a big is an important part of how do we adapt recovery housing for the Valley. And so thinking about, let's just think about the role of family for the Hispanic community. And of course, you need to have boundaries within the recovery home about visiting hours and who can come over, but definitely making an opportunity for families to come. Maybe there's even some, programming or events, celebrations where the family can come. And so they can have an understanding of what the recovery home is, that their loved one is being supportive, that they're not being bad family members because their loved one's living in the recovery home. Really getting their buy-in and their support is going to be critical. So that's like one thing y'all might have talked about. And of course, from a language standpoint, I would imagine that, at a minimum, the house rules would both be in English and in Spanish. There'd be a Spanish sayings and celebrations, and all would be welcomed in the recovery home. I can envision a really rich culture within the recovery home that's reflective of the Valley. All right. What are the next steps towards opening a recovery home in the RGV? Um, Again, I apologize for not being there. It might be a little awkward since I'm not there for y'all to engage in a conversation. But if we want to open up recovery homes, there are individuals who can provide consulting and technical expertise for the nuts and bolts of opening a recovery home. But it is your community that is going to need to adapt that for your particular community, for the population that you're serving. And so be thinking about that. There was, I won't mention the name, but there has been a history of organizations coming into the valley and trying to open up, recovery homes down there. But the individual that they would send was, an Anglo from, Portland, Oregon, or something like that. And so the culture shock, it didn't work. So again, highlighting the need that there are the nuts and bolts, and we'll talk about the NAR standards here in a little bit. There's some basics around the best practices, but then how do you adapt that and make it of the community? Who are the individuals in recovery in your community that would want to step up and support recovery housing? Okay, so here's a group exercise that I invite you to do. Um, First, I'm going to ask you to reflect on these two questions that are on the left-hand side. The questions are, what can we do to open successful recovery housing in the Valley? And so it's thinking about, kind of us as a community, the larger community. Or if you choose, the second question is, what can you do to open successful recovery housing in the Valley? And that may look like you yourself wanting to open up a recovery home, or maybe you're a landlord and you would want to lease a recovery home to somebody opening it, or maybe are a stakeholder in the community that can help, make connections. Just kind of brainstorm and reflect, one, what can we do to open successful recovery housing in the Valley? And two, what can you do to open successful recovery housing in the Valley? So initially, I'm going to ask you to reflect on those questions, just in silence, maybe 2 minutes, think about it. And then coming out of the 2 minutes, hopefully there's somebody to facilitate the room for me. After the 2 minutes of reflection, ask people to turn to the person next to them and create pairs of two. If there's three, that's okay. But it's kind of getting in very small groups. Turn to the person next to you and share your thoughts, your reflections on these two questions. And maybe you take, 5 minutes. It's a little over 2 minutes a person to share what your thoughts are. Maybe there's some fears. Maybe there's some, sparks of, ideas. It's all fair. We're just brainstorming. And then after the 5 minutes, hopefully there's a facilitator in the room that will get everybody's attention and ask everybody to merge two groups to create groups of four. So two pairs into a group of four, and then the four people share what they talked about. And it's more people, so a little bit more time, maybe 10 minutes. Again, taking a little bit, about 2 minutes each, so very, very quick. So y'all can brainstorm and share, and it's okay to steal good ideas. And then after the 10 minutes, hopefully the facilitator can bring everybody's attention back to the front of the room, and then invite people to share out any ideas that they had to the larger group. Again, recovery housing and these social milieu sees community as an asset. It sees it as a strength. And so this is part of the process of thinking about, how do we tap into us as a community to think about, all right, how do we do this grassroots, community-led of supporting recovery housing? So with that, I will stop and let the facilitator take you through the exercise. Oh, you may want to stop the video. Okay, so I'm sure y'all had a very rich discussion. And I'm so sorry that I wasn't there. I was really looking forward to hear the ideas that people had, and I'm going to be following up with Monica and her staff, and listening to what were the ideas, and maybe there's some individuals that would want to do a follow-up meeting and talk about putting an action plan together. But before we end today, I wanted to point you to some resources. There's a lot of great resources around recovery housing. The first, you heard me talk about them before. It's NAR, the National Alliance for Recovery Residents. And let me go ahead and click on this website. So this, if you go to their website, across the top, you'll see lots of different resources. Let me click on events. And that will take you to a calendar. Well, I guess it takes you to the Best Practices Summit, which is coming up in October. It's going to be in Richmond, Virginia. So that is a way of going to the national summit. But let me scroll back up here, and under events, there's calendar. I'm going to click on that because NAR hosts several meetings that you can attend. So the first Friday of every month is an open call. So that's a technical assistance, a free technical assistance call. You dial in and you can ask any question that you want. There'll be national, experts in recovery housing on the call that can provide you with some technical assistance. Even if you don't have a burning question, sometimes you can go on and listen to other people's questions because I've learned a lot. The other thing I want to point you to is some of the other monthly meetings. It's the third Wednesday of the month. There's a learning community call. They bring on really good speakers. So I definitely recommend that if you're wanting to learn more about recovery housing. And then the last Wednesday or the fourth Wednesday of the month is the advocacy call. So for y'all policy wonks, people that really get into policy, that could be a really good resource for you. I'm going to click back up here under resources and scroll down. And these are different accordions. And you can click on these and it's going to show you about NAR, the different standards and ethics. The most current standard is the 3.0 version, and there's a compendium that goes with it. So if I were you, I would download the standard and then also download the compendium, which is it's support material that talks about, what is the standard and why this particular standard is there. And lots of other best practices guides. This is just a really rich library of resources that I encourage you to take a look at. One more thing that I wanted to show you is the affiliates. So NAR sets the standards, but they appoint a state organization to do the accreditation of recovery homes that meet the national standard. And so if I scroll down here, everything in orange are states that have affiliates. And so if we click on Texas, you can see that TRON, the Texas Recovery Housing Network, is the affiliate for NAR. And it's TRON here in Texas that does the accreditation. So with that, I'm going to click back over to our slides. And sorry, we've got TRON. So you can go to the TRON website, and TRON also has different events, educational events that you can access. There's the TRON learning community that's held periodically. There's also a learning management system. So if you want to see the course catalog, one of the things, if you're interested in, sorry about the voice. If you're interested in becoming accredited, every recovery home needs to have a recovery housing administrator that completes the administrator course. But there's here in the course catalog, there's a lot of different courses. I'm going to scroll down, and I think towards the bottom. This would be really good. The Recovery Resident Certification Application Reviewer Guide. social model, understanding addiction and recovery. Here we go. So there's both a recovery house manager curriculum, and I'm going to talk about that in here in a little bit. And then there's a recovery housing administrator curriculum that you can take. And I think that would be a really good foundation for understanding the different standards. Okay, so back to the slides. And the last slide here, the resources with Recovery People. Recovery People, Trone is a subsidiary of Recovery People, so we work very closely with Trone, including we have developed a Recovery House Manager Fellowship. The fellowship covers the cost of students being able to take the house manager training, and then it also gives them a stipend that they can use to cover the cost of them getting their internship hours. So a lot of times, people, they want to get their internship hours, but they can't afford to take off work to go volunteer somewhere. So this is a way to offset that, where people can get their 250 experience hours all towards Recovery House Manager certification. All right. So that's the end of my slides. I so wish I was there. Hopefully you got some benefit out of this. You can always reach out to us at info@recoverypeople.org. If there are individuals who are interested in opening up recovery housing in the Valley, I'm happy to meet with them. The director of Trone, his name is Jason as well, Jason Poland. So we can get him on the line as well and really put together an action plan and think about, how can we support the Valley? All right. Thank you.